Hello, Stephanie Hafe doing Head to Toe. So, my willing participants are not available because of the Rona. So, I am here again with my doll. Which, whatever. So, to start the assessment, I would ask the patient their name, introduce myself. At that same time, I'd be washing my hands, closing the curtain for privacy. Hi, my name is Stephanie. I'll be your nurse today. I understand that you have some knee pain today. I'm going to check out the knee pain, ask you some questions, and feel around, get some vital signs, and then the doctor will be in to see you. Can I have your name and date of birth? Matches my records if I'm on the computer, or some people still do a paper. But I'll check her ID band too, along with her telling me if we're in the hospital setting. And for this, I would normally get like weight, height, ask if I don't measure it. To be accurate, you should measure it. Sidebar. So all the things I'm going to need, I forgot to say that. Obviously, stethoscope, pen light. I don't have right by me. Need to find it. If I'm going to do cranial nerve testing, and you'd want the cotton tip applicator, you'd want all the different smelling jars, you'd want the 3 different objects to put in their hands. You'd want a lot of different supplies, but basic ones: blood pressure cuff, pulse ox if you have it, thermometer, stethoscope, pen light. Hopefully I didn't repeat anything. I do have my blood pressure cuff. So they told me name, date of birth matches, washed my hands, provided privacy, double checked with wristband if they're wearing one. So I'm going to then just ask a little bit more about the knee pain while I'm doing vitals, so I can put the pulse ox on and ask her when did your knee pain start? How long has your knee pain been there? What kind of pain is it? Sharp, dull, constant, burning? I hate that I'm not getting answers from her, or pretending that she is giving me those. Have you had any recent injury to your knee? Have you fallen? Do you have a history of injuries to your knee? And have you done anything to stop the pain? Taken any Tylenol, ibuprofen? Have you used ice or heat? Is there anything that helps the pain? Is there anything that makes the pain worse? How has this pain impacted your everyday life? And this would be an important question, because if, not walking all the time or less walking because of it, avoiding stairs because of the knee pain, anything like that, an interruption in daily life is significant. I hope my cat stays over there and does not come over here. So while I get that pulse ox temperature, I'm asking her those questions, a little bit of history and background of why the knee may be hurting. Okay, my cat did come. I'm sorry. Then she would be sitting in a chair, but her knees don't bend. So she'd be sitting in the chair. I'd tell her, okay, I'm going to take your blood pressure. I would use my blood pressure cuff. Line up the arrow to the bradycardia artery. Put my stethoscope and fingers. Let me put my fingers down here. The radial pulse. You didn't even see. Put my fingers at the radial pulse. 2 fingers, not your thumb. I'd pump it up until that pulse is gone. Know that that top number is about where I want to go, about 10 to 20 above to get an accurate reading of blood pressure. So then deflate it, pump her back up to 10 to 20 over that number, get a blood pressure reading. And then also, inconspicuously, watch for respirations. So I kind of gather that and let her know what I was doing, but also listen to what she has to say about her pain. Then I would ask, is it okay if I inspect your knees, see a little bit further when it hurts, and kind of assess your knee itself? Hopefully they'd say yes. So with her, oh boy, I'm going to look at not just the knee that's hurting, but make sure that both knees are symmetrical bilaterally. I want to look for redness, any deformities, any swelling. So it's very important that you look at them together to notice if one is a little more swollen, a little more red or tender. So always, while I'm touching and feeling too, use the back of the hand for the temperature. When palpating, I'm going to ask her if it's hurting. I'm also going to be watching her nonverbal cues. So is her face wincing, grimacing? Is she kind of pulling her knee away like a jerk? Watching for that as well. Then once I, palpate and feel the knees, I will also look for blood flow on both the knees, make sure that they are equal. Check pulses, pedal pulses too, just to make sure that every blood flowing down the legs completely as it should be equal bilaterally. I also am going to ask her while I'm, feeling around, on a scale of 0 to 10, what is your pain right now at rest? And then Also, when your pain was at its worst, between 0 and 10, 10 being the worst. So I'd ask her a few different, or those 2 different scenarios, and then, along with that history of the pain that I was asking her, you'd also be actually asking, if it's not constant, does it fluctuate at certain times of the day with certain activity? I kind of touched on those already, but just want to touch on them again. Asking specifically for that knee and when the pain might be happening. I'm going to ask if the patient feels any tightness, any tingling, any different sensations other than just a normal knee feeling. I'm going to want to make sure that I check range of motion. So, like I said, her knee doesn't really bend, but I'm going to want her to do the flexion. So, bringing her heel down towards her butt. I'm going to also want her to extend it and bring it back up. Another way to kind of see this is have the patient lay on their stomach and have them raise their heel up towards their butt and then go back down. So for this, I would look at both knees bilaterally, see if there's any difference between them. Again, assessing pain, feeling around if they feel different when they're both flexing and extending, and just kind of watching for that range of motion. Definitely shouldn't have a knee going left or right. Should just be going those 2 directions. So I also want to make sure that the pedal pulse is done. Posterior tibial pulse. Oops, I don't even have her in here. Dorsal pedal pulse. I just said it like 2 seconds ago. Posterior tibial pulse. Just making sure that we have all pulses equal bilaterally. As I had mentioned before, when I do have her doing the extension and the flexion. Yeah, extension and flexion. When she brings her heel up towards her butt, I will have her try and pull my arm. So I'm going to grab her leg and try and pull it back towards me. I'm going to tell her to pull it towards her butt. So just check. I'll have her do it at the same time with both legs. Really checking that the strength is there the same bilaterally. And then when her knees are up at a 90-degree angle, I'm going to have her push her knees towards me as I push against them as well. Checking strength, that's something that she can do sitting as well. Again, her knee would be bent and she'd be pushing up and I would be pushing down. To check that all the strength and range of motion is there for her. And hopefully, at that point, I could tell her I don't think anything is broken. And that the doctor would be in to see her, whether or not based on my evaluation if she would need a potential x-ray. If anything does feel swollen, I would let her know. Talking in layman's terms with her, say everything is equally, okay in both, sorry, equally, okay, and just sit her down. Equal strength in both knees, range of motion's the same, and just kind of let her know that, at least from my observations with her. And then, I will also, as part of the head to toe assessment, of course, do some listening to her lungs. And again, you can't see her. Go in the Z pattern. Listening to both sides, comparing them, making sure everything's equal bilaterally. Listen to her heart. That is in a Z pattern. Last one out here. And then again on the back, just listening as a normal vital sign checkup when she's in there, even though she's not complaining of anything at this time, just the knee pain. I'm gonna, see if she has any cough or sputum, which I can tell when she is talking to me. With that pen light, I'm going to want to shine the light in her eye, looking for the pupil reaction. Should constrict when I shine the light in, and should dilate when I take the light off. So I'm going to check both her pupils for that. I'm also going to look in her eyes to make sure that there's a reflection at the same point in her eyes. I am also going to have her follow my pen light. So I want to go kind of in this X pattern, and then just horizontal and straight across, and have her follow the pen light. Make sure that she has that ability to accommodate when watching the pen. At that time, she would be staring at me. Staring at the pen light. She'd be staring at the pen light, following it with her eyes. Then there's another one where she would be staring at me, focusing on my nose or something. Just common to have someone focus on your nose, and you bring the pen light in to their nose. Their pupils should follow it, known as becoming cross-eyed. So I want to make sure that that is all intact. When I first came in to see her, this is obviously, she's not a real person, so when I first came in to see her, she does have her hair done nice, braided. She appears like she grooms herself. She does have clean clothes on. She's alert, oriented. Appears to be within normal limits. Just on your general appearance overall. She doesn't have face drooping. She's able to do facial expressions, talk, speech isn't rambled. She responds to my questions, talking, any noises, so I know her hearing's okay. I also am going to want to just grab some generals with her. Do you have any allergies? Do you have any medical issues, which can include like history or current? Um, any previous surgeries? Any alcohol use? Any drug use? Are you smoking? If they are, tobacco or smokeless, like a vape. Then I would want to know if there's any family history of any conditions, um, significant family history. I would want to know as well if she's taking any current medications, whether they be prescription or over the counter, as well as herbal tea and supplements. You don't want to forget those. When I do grab the allergies, I want to know about medication, food, and seasonal, and any other allergies she may have, environmental. So those are all part of the questions that I would go over with her as well. And then I'm going to grab, when I said earlier I would listen to her heart, sorry. You want to go just to the left of the sternum, up in the second intercostal, second to third, hop over the sternum. It would be on their left direction problems today. Then go down to the fifth or sixth intercostal. Listen again. Fourth to fifth, I should say. 5 to 6, and then hop over to mid-clavicular area for the apical pulse. If you want to check specifically for the apical pulse, you also have them lay on their left side and listen and palpate that as well. One other thing, that you would look for in general, but I could look for with her complaint of knee pain as well, is edema, swelling. So I would check her. Oh my gosh, you can't even see what I'm doing to her. Sorry. So I'd see if there's pitting, edema. I'm gonna also push on her toenails and fingernails, check the capillary refill. It should be less than or equal to 3 seconds. Unfortunately, I can't demonstrate. I can push on her nail, but it's not gonna refill. It's not gonna go away and then refill. I should say it's not gonna do anything. And just really checking the pulses. I did say I would check her pulse with pulse ox, but I can do both radials too. Check those. Check carotid, but one at a time. This is very important. And when I look at her skin overall, I'm going to look at the color, make sure there's no reddened areas. her color might start with the ashen color. Look for paler as well. I want to know if there's any rashes, scars, insect bites, bumps, moles, wounds, scratches. And again, check for moisture and temp, back of the hand, feeling all of the areas for that. I am also gonna want to check for trigger, so I can pinch at the top by her clavicle, and then I can also specifically go down by her knee and pinch some skin, see if there's any tenting, if I believe it to be swelling or edema there. Most accurate, it's up at the clavicle. You don't want it to tent, you want it to pop back down. So I can check her for dehydration or not. I want to also look in her mouth, mucous membranes, make sure those are moist pink. Looking in the ears, making sure that those are grayish, pearl-like, no redness, no swelling, no perforations of the tympanic membrane. And at the same time, like when you look inside the ear, you can visualize the outside of the ear, if it's red, swollen, any cuts, scratches, rashes, moles. You'll be looking for that all over the skin, no matter where you're looking. Always temperature, moisture, and looking for anything irregular. I will also do a belly exam. So I'm going to listen to her bowels. Left lower quadrant first. Left upper, right lower. Listen for at least a minute. I will move the stethoscope around, listen to whether it's hypoactive, hyperactive, or normal active. Push on her belly lightly, and then hard, or deep palpation, I should say. Light palpation, deep palpation. Just looking for any tenderness. Also, palpating the liver, spleen, checking for any like tumors, bowel obstructions. If she had any of those complaints, maybe she didn't know. So you always want to check. I would ask in general what her diet is like. I'm going to want to ask her how often she has a bowel movement. Soft formed, hard little pebbles, just so I can get an idea of her diet and how her bowels work. So I would do the same thing, urine. How often do you urinate? How much fluids do you think you drink in a day? Is there any color, or ask what the color is. Is there any odor? Asking her, and whether or not she has a history of UTIs, if there's suspect for that at all. I would also try and get a vaccine history. That's something that I would want to know. I'm going to make sure, just to drop back, make sure I'm going to hear S1 and S2, of course, at the base of the heart. I feel like it would go a lot quicker without me saying everything, because I feel like I'm going to take forever. to do these assessments on patients. But then I remember, like, I won't be speaking everything out loud. I'll just be doing it and doing the assessment in my head. So hopefully it won't take me like 30 minutes to do this whole assessment with patients. I can also, if she is saying she has any issues with her scalp, neck, you can feel around for lymph nodes, for clicking of the jaw, have her open it, have her smile, have her shrug her shoulders, just making sure that cranial nerves are intact, have her squeeze her eyes shut, and check peripheral vision. So her and I would be staring at each other, and she would just tell me when she sees my fingers come up into the visual field. I can do that with the pen light too, but it would, we would be looking, and it would be something where she would concentrate on me again. I would also address, like, if I saw snot, sputum, redness, stuffiness, if there's a fever. I think that is it. Thank you. Thank you for bearing with me with a doll.